I've come to the conclusion that I just wanted the pain to stop.
Suicide is a huge concern. If that's kind of the ultimate expression of suffering, then what do we need? What does society need?
It's okay for it to weigh you down. You just can't let it like stop you completely. Getting back up, that's the hardest part. It's really everywhere. Like at least your like child's like friend group, there's at least one or two people in that friend group that, you know, they have some type of like depression or anxiety or like at least a plan of like suicide, that they have history with that. And at least talking about it or making it known and making it known that like you're there for them, that's a very big help. Getting back up, that's the hardest part. My name is Kay Pitones. I'm going into 10th grade and I'm 15. I go to Kunstmiller Creative Arts Academy. I'm pretty into like sculpture right now. I'm a very much perfectionist when it comes to like other aspects in my life, but as soon as it's like self-work and like personal work and, you know, physical labor of me doing something, it gets so tiring, and like the weight of like all the other things that I'm thinking, oh, this has to be perfectly right, and like all that weight, it's just on my shoulders and it weighs me down so much. So talking about that, it was like, it's okay for it to weigh you down. You just can't let it like stop you completely.
The current state of mental health for youth in the state of Colorado is pretty alarming. My name is Dr. Jessica Hawks. I am a clinical child and adolescent psychologist and the clinical director of the Pediatric Mental Health Institute at Children's Hospital, Colorado. The kinds of stress that youth are under is unlike anything any previous generation has ever experienced. And a big part of that is the fact that they are accessible to their peers 24/7. They have access to information and news that is well beyond their development, all the time accessible to them. And I think that's a real concern because it clearly is a mismatch between what an individual can really process and the amount of information that they're able to access.
During the past years in like pandemic and going back to school, it was just like, I know none of these like teachers, I know none of these students, I know none of these names, I know none of these classes. I don't know what subject this is because I don't think I really learned anything through the pandemic. Like I have my notes and everything from like what I tried to learn, but it was just so like isolating that it was like I can't focus. So it's just like more loneliness and like the depression that came in and the anxiety that came in, and it was just like once we finally got back into school, it was like more, I don't want to talk about it even though I'm showing all the like danger signs of like depression or like having a plan on suicide, and it's like so scary because it's like I don't know what to do, but at the same time who do I like tell about this, because we didn't like fully have like the mental health resources that we have now.
There's been national discourse about the importance of integrating mental health care into school settings, and I think the state of Colorado has actually been really a pioneer in this regard.
One of my teachers was like, hey, like there's this children's hospital opportunity with like your group that it's like doing the mental health aspect of like the school and how we break down the stigma and like implement more mental health services into our school. And it was just like, I'll happily take that opportunity, you know? So it just started off as like just spitballing ideas of like, at home, you're in your room. You're always like, you sit in your room with like all your emotions, and you're usually like either screaming into a pillow or punching a pillow or like about to like cry in like your own room. But what if we had that room at school, like a mental health room where you could do the exact same thing and get through the rest of your day?
By the age of 14, most mental health concerns have at least started to emerge to some degree, even though they might continue throughout an individual's lifetime. But when you have been stuck in those mental health difficulties for years and decades, it's a whole lot more difficult to break free from those habits. And yet when we have a young child who's still emerging in their life, they have a lot more flexibility and malleability to them, and there's a lot more that we can do to help transform what their overall life can look like.
So it started off as like, oh, a mental health room. And it was so great to see the input from students of what they would want to see in this room and like how helpful it would be. Some would say, oh my God, you guys are doing the mental health room? And I'm like, yeah. And it's like, oh my God, I can't wait to use that. Because I've tried not to cry like 3 times today. And I'm like, well, you're gonna use a mental health room now.
I know like firsthand how isolating it can be to be like queer in a space where you're not comfortable being out or open. Issues that face this community are as multifaceted as the people themselves. And so it's important to highlight each individual person's experience in that. My name's Bree Donnelly. I'm a licensed clinical social worker, and I work with Joy is Resistance, which is a mobile mental health clinic for LGBTQ youth. I was a school social worker in the far northeast, and the students that I was working with, we kept running into all these barriers to getting clinicians who are affirming to their identity and also affordable and also accessible. So the mobile clinic was kind of an option to eliminate the barrier of transportation as much as possible. It was just me until April of this year, and then I hired my first person, and now we have a team of 5 people total. And everyone's gonna put their finishing touch on what the ambulance looks like. There's gonna be a disco ball up there, which is honestly the thing I'm most excited about.
I'm like legit smiling under my mask,
And that was the main thing with an ambulance that I was really concerned about, was that it was gonna feel really clinical and cold. And so really recreating and reclaiming this space for like coziness, for warmth, for healing was really important to me. Cost should never be a barrier to accessing our services. So we have like 4 or 5 different insurances that we take right now that we're credentialed through. We also offer everything that we do on a sliding scale. So we work with each individual family or nonprofit or school or whatever to find a price that works best for them. So nobody is turned away for cost, but it looks different for different people, depending on their situation. The statistics are all really rough. You know, substance use, suicide rates, self-harm statistics, homelessness, all of those things that come up for our queer youth, and they're at a higher risk for some of those things. And so the thing that has kept me going this whole time is truly like the young people that we work with, who I'm seeing progress with every day. To have that available in our clinicians here is just, it's like amazing. That's the feedback that we get a lot, and that really like makes me feel excited.
I've been doing archaeology and anthropology and photography and all this stuff. And we went out onto the plains and we like investigated this old 1910s to 1940s couple named the Claytons. And they were moonshiners, and it was really interesting. Most of what I like doing is discovering, investigating, and thinking and seeing about anything. My name's Cole Tucker. I'm 18. One day I was coming home from school, and it had been a really bad day. I guess it was sort of the straw that broke the camel's back. It's been a pretty bad year for me, honestly. I don't remember the details of what that day was like. I just hopped on the bus, and I think I had a nervous breakdown. So I got off the bus, and I was gonna walk into a busy street and just let a car hit me. That's how it all started, I guess, from just not wanting to live to actively wanting to die. I was questioning myself because this didn't really seem like a rational thing to do. I just didn't know why I was having this feeling. I stepped out of the street, waited for Mom to come and pick me up, and then I told her everything. I just wanted the pain to stop. If I died, then I assumed that I wouldn't feel anything, and therefore I'd be happy. One thing I've really learned through all of this is that I need to find the good in everything I do, otherwise I'm gonna get nothing out of this.
Cole developed a very impressive photography portfolio in a very short period of time. My name's Thomas Carr. I was Cole's mentor. I was training him to use film cameras, and I know we went on one hike, and it was at the Callahan paint mines, and we get down into the mines, and it's a good 1.5 mile hike, and he takes one picture, and it's the end of the roll, and we're like, oh, we've got your other roll of film here somewhere. Well, we look in his bag, I look in my pockets, he looks in his pockets, nothing. So he only got to take one shot, but that one shot is perfect. It's perfectly composed, it's perfectly exposed, it's perfectly in focus. One of the Red Rocks pictures, there was like a heat damage, because it was pretty hot that day, but the heat damage created this yellowish hue in the sky that actually made it look perfect. And I thought he would have appreciated that. I don't think he got to see that photograph. I printed that after it was too late. Not too late, but until it was, a different time.
Cole's death was a complete shock. He had fought through so much depression.
He couldn't get into like a rhythm, it seems. We found a program in Costa Rica, maybe like a 60-day to 90-day program. He was only there 3 days. And he slipped and fell on a hike and hit his head.
And he was in the middle of the jungle. They couldn't revive him. And it was complete shock to my system. I'm still shocked because it was like I was seeing his life, just passing before my eyes. My name is Lisa Weiss Radofsky, and I'm Cole's mom.
My name is Jason Radofsky, Cole's stepfather. He had this gift of coming across as so compassionate without even saying anything sometimes.
I mean, he was an amazing human being. He was highly mentally aware. And I think that is what Cole really wanted people to know. I think that's why he put himself out there with the first interview with Rocky Mountain PBS.
I've come to the conclusion that I just wanted the pain to stop. Being suicidal seems so prevalent today. I don't think I can talk to every kid on earth and invent some sort of giant microphone and just yell out my message 24/7. I can't. But I mean, I can reach a lot more people through this, so I'm just hoping it helps.
He was put in a position to defend and protect and advocate for other people, and what he lacked was advocating for himself. And that was really what pushed him to go outside of his comfort zone, to go to the program that he went to. It was something that he really wanted to do.
This was going to be the change, and he was happy. He was happy that he was making this choice for himself. He was happy to be on this journey.
I feel confident that he was at peace and that he was happy to be doing what he was doing and proud of himself for doing it.
And we would talk about mental health. You would talk about mental strength and how important it is for humanity to overcome those kind of things. Take in the little things and just try your best to live as good a life as possible.
I just think that he would want his life to be remembered. He has such a hard life, but he was so strong. He had struggled through it all, and he had made it through it all.
COVID really, it shaped me as a person because, it tore me apart. I know being online, it just, it hurt me so much. I know I was feeling very down every day, and, it taught me that you've got to be just so grateful for everything. During COVID, I lost loved ones, and, that took a toll on me too, because it taught me that you can't take life for granted, and that, things will always happen that aren't in your control, no matter what. I have used the iMatter sessions, and they've really helped me a lot.
I think iMatter is doing a wonderful thing by providing 6 free sessions to our youth, because it really does address a lot of the barriers that youth might face in accessing care. Therapy allows a space for people to feel accepted and seen and understood. It also allows them to kind of have a lot of autonomy when it comes to choosing their clinician, right? Or signing up for themselves if they might not feel supported by their guardians or their family members.
I had to use iMatter because I really, was just feeling a little bit sad. After spring break, everyone had gone back in person. I was like one of the only people online, along with a few others. And, it really, made me really sad seeing others, like interacting with all their friends and, me not being able to get that opportunity because I was also new freshman year. So
it feels amazing to be able to just be a part of a system or a program that makes it really easy for youth to access services.
The suicide rate in the state of Colorado, for example, for youth is very high, particularly in the mountain region. So suicide is a huge concern. So your question leads me to think, if that's kind of the ultimate expression of suffering, then what do we need? What does society need? My name is Janina Fariñas, and I'm the CEO and founder of La Cocina. La Cocina is a nonprofit mental health care clinic. We are Latinx founded, Latinx led, and Latinx serving. La Cocina means the kitchen in English. The story of our name comes from really Dolores Huerta and Cesar Chavez. They used to organize in kitchens when they organized the Migrant Workers Union in California, and they would often close their meetings by saying, "Todas las revoluciones comienzan en la cocina." All revolutions begin in the kitchen. At some point, a group of us, myself and other Latinos, got together to identify the needs of our community, which were specific around mental health care, and we decided to found La Cocina.
Yo tengo un niño que fue diagnosticado con hiperactividad. Después del diagnóstico, empezaron los problemas en la escuela. Hola, mi nombre es Teresa González y resido en Fort Collins, Colorado. Después del diagnóstico de mi niño, yo tuve como mucho ansiedad y quizás tal vez depresión también. Pues hasta ahorita ha sido la peor noticia que he recibido en toda mi vida. Tuve terapias por un año. Tuve que cambiar a mi niño de escuela porque la primera escuela no ayudaba, no cambiaba nada. Todos los días eran problemas, todos los días yo tenía que ir a la escuela a recogerlo porque ellos no querían batallar y tampoco querían como buscar una solución para mí y poder ayudarme, porque yo me sentía la peor mamá del mundo. O sea, yo me sentía culpable de lo que pasaba porque así me hacían sentir en la escuela. Aparte de que tiene mi niño hiperactividad, también fue diagnosticado con autismo. Si yo no hubiera tenido el apoyo de La Cocina, la verdad yo no sé qué hubiera hecho.
Really, in terms of trends, for a very long time, I think people believed, and this is not uncommon for Black and brown communities, people believed that the mental health care of our community was much worse than for white communities. But that's really a misconception. It's a misunderstanding of what actually goes on. In fact, here at La Cocina, because we primarily see children and families, the majority of the work that we're doing is helping families navigate the mental health care system because they don't know how to do it, because it's very, very foreign to them.
Para un inmigrante llegar a un país donde no tienes a nadie, donde estás prácticamente solo con problemas de idioma, de transporte y todos los retos que trae ser inmigrante. Mi nombre es Ana Raquel Gómez. Yo tuve esa gran bendición de llegar a La Cocina y me brindaron ese soporte emocional de decir somos una organización para la comunidad latina. Te alegras con el simple hecho de que alguien te hable en español. Es como que es un alivio.
The needs, for example, might be identified elsewhere as having something to do with the diagnosis of depression and anxiety. And while that may be true clinically, for most of our community, it seems to stem directly from lack of access to services, lack of access to money, and really not being able to understand how to navigate the system. If one piece of knowledge is dominant over all other knowledge, then everyone else thinks they're wrong. And that is one of the things that we shift. We say we value the knowledge of our customers, of our clients, of our patients. And we elevate that knowledge because they know better than everybody else what's actually going on. So this piece about allowing our community to really define for themselves what the healing journey is, that needs to be centered. Society needs that, because then no one is wrong about the way they heal.
El equipo de la cocina, la verdad, es una bendición en mi vida. A mí me ayudó mucho, a mi familia, a mis hijos, y pues la verdad, yo súper recomendados y pues yo los veo como mi familia. Hay esa conexión, ese amor de que pues uno se siente en confianza y yo así lo siento, que son de mi familia.
I want to be honest, it's scary, but it's so self-fulfilling. Knowing that if I make that step, somebody else of color comes and makes a step, somebody who's queer makes that step, the more we march together, the more you'll see more of our representation. My name is Garina Muro. I am a full-time social student here at MSU Denver. I grew up in Wisconsin, which is a small rural farmland county. Since I am a Latinx queer woman, growing up I noticed there wasn't a lot of resources available for someone like me. And so I want to be a clinician that is able to help the vulnerable populations. That one person does make a difference.
One of the reasons why it's so important that we build a workforce that is diverse, right, is we have children and families from all across Colorado communities. And yet, if I'm a person of color or if I'm gay, how do I get services, particularly clinical services, when there's nobody in my community who looks like me, who understands me? So what do we do about that? And how do we build our capacity? One of the things that I've been talking with David Aragon, who's at Colorado Access, about quite a bit, is how do we build the pipeline?
Colorado Access is a healthcare network that is providing primary health care and behavioral health care services to members in Denver County and 4 surrounding counties. Our healthcare system as a whole is recognizing that there's an opportunity to be more mindful of issues related to diversity, equity, and inclusion. It's important that we are providing the best care that we possibly can, but ultimately too, it's about diversifying the workforce. Maria Drost is a great provider network that works with Colorado Access, and they worked hard to identify what are the obstacles in access to care, what are the challenges in developing a workforce that is more responsive to people from diverse communities.
And then that's what the Diversifying the Workforce initiative is trying to tackle, is really focusing on the pipeline going out throughout the entire system. So we start at the lowest levels, earliest educational levels, to allow youth to understand that they do have potential career possibilities. We also partner with universities to get them through the educational process, because as we know, a lot of these diverse communities do struggle in the university environment. And by the time they get to us, hopefully, they'll have that full lived experience of support, and they'll be ready to start their careers helping people.
During my first semester, my policy professor, Dr. Dawn, was another instrumental supporter and cheerleader for me. She asked me, what can I do to help? How can I support you? What do you need? Over and over again throughout the semester.
She was a student who was clear that she has a voice, she has a position, she believes in social justice. I quickly was able to persuade her that we have to change systems. So the best way that we can affect change is to help individuals, but also change the systems that they work in. So it's interesting because part of what makes you a really good clinician is the fact that you have a strong ability to build empathy. But we know from research that that same empathy, that same capacity you have to empathize with others actually places you at greatest risk for burning out. So then what do we do, right? So if it's the person we need has to have empathy, but then that empathy itself contributes to them burning out, then we have to change our system. One of the ways you can do that is obviously being self-aware, being able to say, I am getting what I call is crispy, I'm starting to burn a little bit, and then be on teams where they allow you to be vulnerable and they allow you to say, okay, what do we need to do?
November, I had my crispy moment, as Dr. Dawn mentioned, and wasn't sure if this is something that I was going to pursue further. And during that time, I spoke to my wife, Mindy, and I had said, I don't know if I want to do this. I don't know if I want to continue. And she reminded me, if you decide to quit, who's going to help somebody like you who wants to quit? That was my answer. And I think it's a metaphor that I live in Colorado because I can't tell you how many mountains I've summited, and it's not easy. So when somebody of color and somebody who identifies as queer makes the journey alone, it can be daunting, overwhelming, and jarring. So I want to be their supporter, be their cheerleader, however I can be there to help them.